afternoon, everyone. Today I am here with my guest, Dr. Jeff Pettey, who is the Co-Medical Director of Global Outreach Division, Vice Chair of Education, a Residency Program Director, and an Associate Professor of Ophthalmology and Visual Sciences at the University of Utah, Moran Eye Center. Welcome, Jeff, and welcome, everyone. What prompted Moran Eye Center to train in manual small incision cataract surgery? We also call it MSICS.
Yeah, cataract surgery has had such an interesting evolution from doing manual delivery of lenses with large incision extra caps to adoption of phaco. And in countries where phaco is primarily adopted, we've continued on that path with phaco. In fact, when I trained in my residency, 2007 to 2011, didn't see an actual manual delivery of a lens the entire time, whereas the rest of the world continued with extra cap and this surgery as it would. It evolved into this really beautifully elegant sutureless extracapsular cataract surgery. And it's not only done now in those countries where phaco didn't take off. Phaco is of course now becoming prevalent throughout the entire world. And now actually in countries where, again, we've primarily trained in phaco, there's a real burgeoning interest and this kind of organic interest in learning this sutureless extracapsular cataract surgery for a number of reasons, not the least of which, and this is really the most important one, the more surgical skills a surgeon has, a resident has, the better surgeon they will be in the end, and ability to perhaps use a different technique when it can be better for that patient can only come when you have exposures to those techniques.
Why is it important for practicing surgeons to learn MSICS, and how can this apply in developed regions like the US, Canada, or Europe?
Yeah, the primary one that you'll hear people talk about is an ability to convert from phaco to SICS. Something's going wrong. We need to get this lens out and do it in a way that is, hopefully more safe. And that while that is the early perhaps interest by some surgeons, what we've really found over time is the ability to have this skill at a high enough level where you can primarily do this surgery. As I sit down and look, I'm going to say this lens could be done phaco, could be done small incision, but what is the most safe? What's going to be the best outcome for this patient? And again, it only comes with I'll say mastery of a second technique that you really have an ability to go back and forth between them. I've started a surgery doing SICS and actually converted to a phaco and vice versa, depending on what I'm seeing and what's happening with the patient.
What is the typical profile of a surgeon that comes to Moran Eye Center to learn MSICS?
Yeah, really, strictly speaking about learning sutureless extra cap, there is a path. So for a phaco surgeon, first of all, the one thing that you may not be exposed to a lot is the scleral tunnel and the scleral groove, right? We just don't do as much work with clear corneal incisions. And that's the first thing. And that could be done in kind of wet lab settings. You can actually gain a lot of mastery on your own in terms of the tunnel, which if there is a step that is the key step, I would say that's the one. As soon as that's done well, a surgeon, an ophthalmic surgeon can fairly, I'll say perhaps creatively do a delivery of a manual lens as long as that wound is constructed well. And so for people that are coming to us with interest, it's going to start with, you need to become a student, it's watching videos, it's getting a book, it's doing wet lab time on your own. And at some point you do need to sit down with someone who is a master who can help you do this in a way that's safe for patients so patients can have equivalent good outcomes with you as you're going through your learning curve and process. And that's really where something like a virtual reality simulator, the HelpMeSee simulator, can come into play and really shorten that learning curve for individuals in a way that they can continue to have good outcomes for patients along the way and not have to take, we'll say, weeks and weeks and months, or perhaps even years over years to learn a surgical technique.
Thank you for listening to this episode of Eye in 5. We hope you will join us next time as we continue to unite partners and like-minded individuals who are working to bring hope and the gift of restored sight to millions of people living with cataract blindness. Please be sure to subscribe to Eye in 5 on YouTube and share this podcast with your colleagues.